What's up, listeners? This is the 5th episode in our Health Highlights series, recorded live at the Health Conference in Las Vegas. We asked leaders how they're seeing the consumer point of view being incorporated to bridge the gap between traditional sick care and consumer-based well care. Today's episode focuses on advances in personal health data. So you'll hear from Welldoc's Chief AI Officer, Anand Iyer, Health Gorilla's CEO, Bob Watson, and Komodo Health's President, Webb Sun, and Head of Revenue Strategy, John Wollman. Let's get into it. All right, can you give me your name and title real quick?
Absolutely. Anand Iyer, Chief AI Officer of Welldoc.
What was your background prior to Welldoc?
Telecom, wireless technology strategy for almost 2 decades. And prior to that, all of my doctoral work was actually in AI, earlier incarnation of AI. And in that journey, I developed diabetes myself. So I affectionately joke that, I have AI in my blood and too much sugar in my blood. And somehow Welldoc has managed to fuse the two. So it's wonderful.
How do you help guide somebody who's trying to make sense of what they're hearing about AI?
It's a great question. Maybe we start with what's the problem we're trying to solve. That's always a good place to start, which is if you look at the chronic condition state of the union, means how are we doing with diabetes? How are we doing with hypertension, heart disease, heart failure? The biggest cost centers for us in our healthcare system. The gap between where we need to be in terms of outcomes and where we are is increasing. And the gap is increasing not only in measures, but it's also increasing in numbers. There are more and more people being diagnosed, right? Yesterday in one of the sessions, 50% of Americans are technically obese, right? BMI over 30. And so we have to ask the question, it's Einstein's definition of insanity, right? To keep on doing the same thing over and over again, but expecting a different result. We have to do something differently. And the difference here that AI and only AI can enable is how do you provide personalized guidance to someone under the auspices of clinical evidence-based medicine. So you have the guardrails of clinical evidence-based medicine, but how do you provide the personal, for you, that pathway isn't going to work, try this, right? So think about the standard of what happens with the patient. They go see the doctor, get diagnosed with something. Doctor says, okay, I'm going to put you on 1,000 milligrams of this. Come back and see me in 3 months. We'll see how it works. What if that's the wrong answer? Instead, if we can collect data, even 1 week's worth of data, 2 weeks worth of data, and then use that data and AI to say, based on this pattern, this is probably the best pathway for you. Let's go here. So a probability of success in getting them to the right treatment pathway and getting them to do the right things because now it's personalized for them. That's why we need AI. So people talk about it a lot, but we have to use it in the context of how can we achieve personalization at scale? That's the conundrum.
So at what point will we get to where clinical staff is comfortable kind of leading that discussion? And granted, that's a loaded question, right? Because not only is every clinical staff different and a different point in their journey of understanding and the resources available to them, but I'm thinking on an individual encounter between a patient and a provider. And that still, for the most part, is the trusted relationship. That's the basis of a healthcare experience. And so if I, as a patient, do trust my provider and I am bringing questions to them, then I'm going to trust what they say more than what I hear elsewhere, but I am going to listen elsewhere at the same time. So when I'm thinking about it from the patient's point of view, they are trying to navigate a lot of information, misinformation, disinformation, and somewhere in there is the right personalized path that you just described for them. And they're going to need to be guided along that path. Yeah. So I'm just wondering, where does the clinician fit into that right now?
Yeah. So it's a great question. I think they fit in a number of levels. So first of all, the set of physicians have to be involved in the design of these digital health solutions, which means the underpinning of these solutions, the algorithms, et cetera, have to be tied to the same evidence-based medicine that they train on in medical school and that they practice, okay? A lot of times you'll find that these companies circumvent that. They go and say, look, I got a bunch of smart tech guys. Let me build something. They haven't talked to us. Saying, find me today one doctor that actually likes their EMR. Great example, right? They all hate them, right? Because nobody was asked, how do you want to see data? In what format? With what workflow? Okay. So first role that they have to play, co-creation of the solution. Okay. The second role that they have to play is people always, you'll hear it a lot. There's a fear, uncertainty, and doubt. Will AI replace physicians? And the answer is hell no. But would a physician who uses AI potentially replace a physician who doesn't? I think quite possibly. So they are hungry for clinical decision support. Why? Patient comes in with a whole bunch of problems and they have 5 minutes in that scarce time, FaceTime. They're asking you, how has your diabetes been for the last 3 months? I don't remember what happened yesterday, let alone the last 3 months. So if there's some tool that is supported by evidence-based guidelines, that's been through the rigor of FDA clearance, that's trusted, okay, then they can use that trusted source as an extension of their clinical care. It becomes an extension of what they do when they're not with the patient, right? So that's a second level of trust. And then I think the third level of trust is just for us as manufacturers of digital health solutions, what the FDA calls SAMD, or software as medical device. We have to make sure we respect privacy, security, cybersecurity, all of those things to the highest standards. You think of things like high trust, you think of things like SOC 2, you think of things like IEEE 2621, all these standards that we have to meet. And when we do those things, we inherently build a basis for trust. Trust directly with the patient and the solution, trust with the solution and the provider, which then amplifies the trust between the patient and the provider, which is kind of cool.
Yeah, so we have some work to do as an industry.
We do. At the same time, if I were to answer the question very differently, Jared, iPhone came out what year?
2007.
Very good. And we're now in 25. That means the iPhone generation is going to college. And that means they're going to medical school in the next 4 years. And do you think they're going to want to graduate with the stethoscope that goes to-thump, to-thump, to-thump when they have tools that can give them ECG, PCG on the back of their smartphones? No. So I think there's an inevitability with the next generation. Hope. There's an inevitability that I think this is going, we're not going to call it digital health in 5 years. It's going to be health. And if it doesn't have a digital component, it's not going to be relevant.
I'm so with that. Like, I'm so aligned with that thought. We haven't seen it at scale yet, but it is just how you think of it. It's how the consumer thinks of it. They're literally just like, they don't even think this is health, this is wellness, this is sick care, this is preventive care.
So I'll tell you something else you're absolutely right, but I'll tell you something else about the rate of absorption. Like, how quickly will this happen? If you step out of the healthcare and AI discussion and you just look at disruptive technology and the history of disruptive technologies, the internet, forget about Al Gore for a second. The internet's been around forever, okay? Early 50s. But it only took off when Netscape as a web browser was on people's desktop PCs. Why? It democratized access to the internet. Okay. Same thing. AI has been around for a long time. Alan Turing, 1956, standard definition. Okay. But it didn't take off really until ChatGPT, December 2022, put it on everybody's phone. I think what's happening with healthcare and AI is we're starting to get to the point where it's being democratized, because every patient has access to these tools. Every provider has access to these tools. Not all the answers are correct. They're still getting that right, but there's at least a basis. At least somebody is empowered to go to the internet and ask these questions so that they at least raise their knowledge IQ of their condition. And then they have a more informed discussion with their physician, who ultimately makes the calls on their treatment pathways and whatnot. So I think that's happening faster because we're democratizing access to AI in all of these LLMs that you see on everybody's devices, right?
Yeah. What's the latest and greatest that you're excited to share?
Yeah. So on so many fronts, I think that how we're systematically working within the guidelines of the FDA's PCCP, which is that pre-control change process, to ensure that we put responsible, well-governed AI in our cleared medical device products. That's something that we continue. We've just completed what they call a Q-sub with one of our leading examples of CGM prediction. So can I use from a CGM sensor, continuous glucose monitoring sensor, can I look at the time now and can I predict every 5 minutes out, maybe 1 hour out, 2 hour out, et cetera, what my glucose value is going to be, and do something with that, kind of preventive, keeping them in the safe zone. That's something that we're actually going to be submitting to the FDA imminently, which is really exciting. But then even on the simpler side, we announced in June a program with Lilly Health to support their incretin therapies, which are Mounjaro for diabetes and Zepbound for obesity. And these tools under the PDURS guidance, or the prescriptive drug use related software, what FDA calls it. Yeah, I know. It's a mouthful. But those programs are becoming in vogue. So that was actually a big announcement where our platform, because of its configurability and its flexibility, was quickly customized by their team to support, if you would. Think about GLP-1s. It's not just about sticking yourself once a week with an injection of these two drugs. It's about strength training. It's about side effect management. It's about protein management. There's so many things that the digital health tool, as a accompaniment to the drug, as a surround sound, if you would, to the drug, make it more effective. So those are some of the things that we're working on that are really fun and cool.
Very exciting. And again, very applicable to a lot to millions of patients. And as we work as an industry towards improving the experience for everyone, we'll be able to see some very clear touch points, I believe, like between now and the next few years. This is a pretty revolutionary time we're living through right now.
It is revolutionary, and it comes with a great sense of responsibility. And so I think here again, adhering to the quality standards, adhering to the governance guidelines for AI, responsible AI, those are all things that we shouldn't even talk about. They should just be table stakes. Of course, it's assumed, right? It's like you have a construction worker come to your house and they're going to be drilling through metal. They're going to wear goggles. Nobody asks that, right? It's assumed they're going to do it because it's part and parcel of what they do. And so in many ways, I think that's where the dialogue is headed. Let's assume that table stakes, all the capabilities, all those enablers are in place. How do you now take advantage of these rich data streams, whether it's medication data or education data, or what they're eating, or how they're sleeping, or how they're exercising, or their symptom, how they're feeling, and how do you use the power of these AI engines to take that data and to figure out, I use the analogy of Google Maps, turn-by-turn instructions on how to manage your health. There's something for food for thought, and that's where the future is going to be.
Thanks for your time.
Thanks, Jared.
Bob Watson, CEO, Health Gorilla.
Let's lead off with the latest news or announcements that you'd like to share about Health Gorilla.
I think two things. One, we had an announcement, I think yesterday or today, a relationship with Altera, which is the former Allscripts HR clients, that they finally released their version of the integration between us and them. So we can start offering their physicians and their physicians usable data.
Tell me more about that. Like, how is that applied, or like, what's the application of that now that that's available?
So, look, I think here's the problem with the pipes that are the QHINs or the legacy networks is, for the most part, they simply deliver data. If you're a physician, you don't want, reams and reams. Reams is a paper term, obviously, but just plenty of documents that aren't helpful. What we focused on with both before we deliver it to our end users and with our EHR clients are the following. When we deliver it to our EHR clients, we want to make sure that that data is clean, deduplicated, normalized, and in a format that it's what we call AI ready. Then they run their AI on top of it to deliver an experience for the physician that's positive. But frankly, most important to us, and to me personally, is we're getting usable information to the physician at the point of care when they need it. Mm-hmm. People deserve to have better health care.
I love framing it that way, because I think that's a strongly held belief, and it's always been, well, how do we do that? How do we get this actually in place? And people forget. You mentioned the pipes, the data that's underlying all of it. We've only been able to make so much progress as an industry without having that in place. So being able to focus there, it's interesting when we think about. We like to say on the show we're spotlighting the consumer point of view, right? Well, the consumer point of view is they're not even aware of how it works now, right. let alone how it could be improved. For the most part, when they do run into it, when they like to access their own medical records, clearly maybe something like, their patient portal, my chart or whatever, that might be one of the more accessible ways they are looking at their own data. There's always help that's been needed there.
Yeah, but the problem with that, if they're in my chart, they're only going to see the data from that particular facility, and occasionally, if they've been seeing somebody somewhere else that's part of that health system, they'll see that data. But what about when they went to a different hospital or an urgent care center or some other provider that's not on that network? Where's that data?
Yeah, exactly.
I'll give you a couple of real-time examples from our own team at Health Gorilla. I have a woman on our team whose son had a sports accident, broke his arm, went to urgent care. The break was bad enough that they referred him to Boston Children's. Great hospital. They could not transmit the information electronically. She had to go get a thumb drive. It's 2025 and it's Boston. That's insane. Yeah. And then if you look at another associate of ours who's in Atlanta, told me this story at dinner last night that his father had an MRI and some other clinical workups done at Given Health System in Atlanta. Because of the nature of the problem, he had to go to the other big health system in Atlanta. He had to go pick up a thumb drive and a CD. Who has a CD reader? I mean, how's that possible?
Yeah.
And, in my own personal experience, I moved from Atlanta to North Carolina 3 years ago. I have sent 11 release of information requests to one of the big health systems in Atlanta, and all I get back are visit notes. That's not enough for my doctor to give me good care. It's not enough.
Not at all. Where are you seeing more opportunities happen for us to finally modernize from that? like from the experiences you just described?
Well, I think everybody's heard about the CMS aligned networks. It's a push by Secretary Kennedy and Amy Gleason at Doge. We are a QHIN under TEFCA. TEFCA is going to survive in some form. It might be called a CMS aligned network. I don't know. But one of the things that's clear to me is they're going to put teeth in it. And the teeth comes in two forms. One is, this is a statement they made, which I thought was just fabulous, which is it's voluntary but not optional to participate.
Yeah.
Voluntary, what a fabulous phrase. I use it all the time. I want to try that with my kids. And you can look at, so I see the data for all the legacy networks, all the other QHINs, and our own data. QHIN traffic this year is up about 3 or 4-fold from last year. The legacy network traffic is down a little bit, but continuing down a little bit in a retro growth rate. They're still increasing, growth rates slowing because people are moving to the QHIN.
Yeah.
So, but we're starting to see adoption. If I look at our own, like for one of our EHR clients, we've onboarded, I think, about 100 hospitals and probably 10,000 physicians this year. That's outstanding. And it gets to the patient, right? And we're working with our EHR partners to deliver actionable data to the physician at the point of care, which benefits the consumer.
So how do you explain that momentum that's happening to someone outside of healthcare? It might be easier just to think like person-centered care, or whatever we want to think about it that way. But it's all the things that lead up to being a patient, and those are most days. It seems like for most of us. So not necessarily thinking, oh, hey, here are all the things that are going to influence my next time of where I decide to go seek care. Right? Like when it happens, and it's urgent, and it's important, and it's emotional. So how do we share? Because it feels like good news to at least let people know that we're seeing momentum here and we're getting somewhere. But it's always like you said, hey, look, the pipes are better right now, or I don't know.
Well, here's my view of the momentum. Oracle, Cerner is lining up to get their QHIN. Epic has theirs. NetSmart has theirs. eClinical Works, Athena. The big EHR players are already bought into it. So they're starting the process. Ultimately, that all benefits the patient. From our perspective and our focus and our ideal customer profiles, we focus on all the other EHRs that aren't them. And so we're equipping the small, rural, critical access hospitals so that those physicians in some small town in Southwest Georgia can actually do a better job of treating that patient. Because that patient in Southwest Georgia, by the way, probably has been to a hospital in Atlanta or Jacksonville or somewhere. This will give an avenue for those people in less favorable, markets, smaller markets, to have access to their records so they get better care. At the end of the day, I think people realize that better care is really important. And I think that's a driver.
It is. Okay, well, that's a great way to explain it. Like, that's important. We recognize that, and there's some really cool things happening to get us to a better place there. Yeah. What about you personally, Bob? Like, what are you kind of paying attention to right now? Like, we're sitting here at Health. There's clearly a lot of buzzwords, but there's also like a lot of useful trends I feel like that are being talked about. Like, what's kind of in the middle of your radar screen these days?
Look, I think anybody's interested in enabling interoperability is somebody I want to talk to. They have a play. I think the other extension of what will probably happen during the term of this administration is opening up payment and operations under TEFCA and individual access service under TEFCA. So people that are touching those areas are people I want to talk to. Plus, we have 30 or 40 clients here. So
fantastic, Bob. It's been such a pleasure. Thanks for sharing us kind of what you're paying attention to and what you're excited about. Thanks for joining us today.
Great. Thanks for having us. Thank you very much.
Hi, I'm Webb Sun, co-founder and president at Komodo Health.
I'm John Wollman. I'm head of revenue strategy at Komodo Health.
Why don't we start with the news and announcement in terms of like, hey, we're sitting here at Health and there's pretty big news coming out of Komodo Health. Why don't you share that with us?
Awesome. In August, Komodo Health announced the global launch of Marmot, our healthcare analytics AI. Marmot is powered by deep domain expertise in healthcare analytics. It's powered by our healthcare map, which is the industry-leading representation of what's happening in the healthcare system. It has all of the validated and best-in-class methodologies baked into how it does its work. And on top of that, we've enabled full trust and transparency through fully auditable methodologies and code that can be reviewed and exported into your own environment.
Yeah, we've never seen, I've been in this industry for over 38 years. I've never seen so much excitement for a technology healthcare product in that span. And it's overwhelming. Like, we're so busy. It's incredible.
How do you put that in terms of like where the greatest value is overall to the healthcare system?
The greatest value to the healthcare system is going to be realized by the fact that we've fully democratized the ability for anyone who's able to ask the right questions and provide them with insights that are fully actionable and powered by the best data in order for them to do their day-to-day.
Yeah, I think if you look at trying to solve the triple aim, make sure that patients are getting healthier. To get them healthier, you need to be able to understand and analyze broad populations or narrow populations. You need to be able to do that at scale and at speed, and Marmot really does that. It's kind of neat. Like, one of the things that's really important and different is, in addition to all the auditability and the transparency, it's not a black box, but Marmot lets you do just simple exploratory analytics. You can just ask any question you want and it'll give you an answer, but you can also constrain your analytics to specific populations, specific disease states, specific outcomes you're interested in. And in doing so, you can really, really bend the curve. We think Marmot, if you want to bend trend, Marmot's going to be a big part of that answer.
Are there a couple of either use cases or specific verticals that are kind of leaping off the page in terms of like, here's something like just super, super cool that we can point to of like how this is making a difference?
What's been exciting for us is Marmot has already been adopted and it is being used in multiple customer segments of ours. Life sciences across clinical, commercial, health economics, and outcomes research teams. Outside of life sciences, we have consultancies that are using Marmot's Ask Me Anything capabilities, and all the way through to entities like financial services companies that are trying to better understand things like what's going on in the GLP category and which weight loss drugs are taking off or taking more market share, et cetera. There's so many use cases because the reality is, to John's point, you can truly ask Marmot anything. And if you're a generalist, Marmot can help you and guide you through prompts and can help you in terms of suggesting other ways, other things that you're trying to explore as you're prompting Marmot. Or you can go through as a sophisticated end user, ask a really powerful prompt, and then go from there. John's been working very closely with a lot of our early customers, and so I'm sure he'll have very specific and interesting use cases that he can share as well.
Yeah, it's a good question. In my mind, there's lots of things that the LLMs and generic AI tools are being used for. They're answering simple questions. And we can handle simple questions too, but we can also handle patient journeys. And that's where it's really exciting. So being able to take Web's Pointer Healthcare Map, 330 million de-identified U.S. patient journeys, and be able to use this kind of massively scalable technology and inference capabilities to identify patterns and signals within these patient journeys, that's the really exciting part for me. And also on the clinical side, of course, being able to identify new ways that you can use existing molecules to cure disease, additional disease states. And there's just so many things that we're going to be able to do that, it's going to dramatically improve care outcomes at lower costs.
This really is part of a bigger vision, I feel like, of the evolution of what's happening with healthcare, bridging the gap between traditional sick care and preventive care. We no longer have to wait until somebody gets sick to rush into action, use all these tools that we have, use this data. We now have more capabilities. We, as an industry, have more capabilities than we've ever had. And what you're describing plays a big part in that. How do we convey that value to those who maybe have thought of something like this in the past, but the tools, the data, the platforms weren't there before. And so now they're like, I don't know if this is going to work. Now that things are working, like now we have the platforms to do a lot. How do we help convey that value?
In the healthcare analytics AI space that we're occupying, what we're observing is a lot of the early adopters of the generic LLMs and the kind of horizontal large models, a lot of those actors are coming to the realization that healthcare is different. Healthcare has a higher bar. Healthcare requires more rigor around the methodologies. And so when we go out and we show them that Marmot is powered by our healthcare map, when we show them the rigor that we've placed behind all of the methodologies that we're using to answer their questions. To give you some context, we've had over 1 million unique patient cohorts created and studied in our platform. All of that results in additional learnings that power and refine Marmot's outputs. And so for any generalist to come into this space and occupy it and say, hey, you should try my AI, we're holding our customers to a higher standard, and we're providing the evidentiary standard that powers the recommendations that we stand behind. And I will also say, like John, I've been in the space for over 30 years. And when we show it to the best consultants from McKinsey, ZS, Deloitte, et cetera, and when we show them the rigor behind the methodology, when we show them the outputs, and when we show them the various ways that we've created for Marmot to immediately provide actionable insights that are at their fingertips, The beauty of it is they can run 5, 10, 15 different very sophisticated studies in parallel, go get coffee, and then come back and the work is done 3 minutes later, which blows my mind.
I love what you're saying there, Webb. I have a very specific example for you that I just ran in Marmot for a customer this past week. If you look at chronic kidney disease and heart failure, we know they're correlated. We know that many times when you start with one, you get the other, and you wind up having both. We just did an analytic in about 7 minutes that could look across hundreds of thousands of patients and show you the pathways from one to the other. What is the time in between them? And also look at predictive factors that could tell which patients are likely to move, so that you could do preventive care to keep them from getting the other disease. I'm not saying that the technology or the current standards of care.
Human expertise.
Correct. I'm not saying there. In some cases, it's too late to do anything about it, but in many cases, you'll be able to catch these things earlier and prevent diseases, and that's really cool.
What else haven't we discussed that you're paying attention to, like trends that are just in the middle of your radar screen today? Maybe not even here at the conference, but the things that you're paying attention to, trying to keep up on.
For me, the biggest observation I have is AI has touched so many parts of healthcare. You have everything from automation of things like prior auths and step edits and things like that, all the way through on the pharma side. We've seen AI dramatically impacting drug discovery, compound creation, etc. One of the areas that the space that we're occupying, healthcare analytics AI, there's currently no leader. And we're stepping into that void in terms of fulfilling a need that our customers have, which is, how do I make informed decisions? How do I make informed decisions faster? How do I do it without the traditional kind of over-reliance on my armies of outside experts and consultants? That's what we're doing to enable our customers to move faster, bring therapies to market faster, and work in concert with Komodo Health to reduce disease burden.
Webb and his founding partner, RF, they built a great company based upon taking really this fragmented data that we have throughout the industry and making sense of it, and then building technology on top of it and selling all of that together to make it easier for people to adopt it. And we built a really good business, and we've grown really well in doing that. But the amount of work it took to use our tools historically was an impediment to really changing things as fast as we want to. And if you look at what these new AI tools are capable of doing, it just blows my mind. Like as I said, in 38 years, I've never seen anything like it. I've never been so excited about the possibilities to really, really, really leverage this great data asset, leverage our technology, know-how, and our methods to really change things in a rapid basis.
Yeah, there's a lot going on. It's quite the time to be in this industry and doing the kinds of things you're doing. So just want to thank you both for joining the show, stopping by for a few minutes, and looking forward to seeing what comes next for you guys.
Thanks so much for having us.
Pleasure to meet you. Thanks for having us.